Let's discuss an important topic. Is paracetamol daily use safe or dangerous? Paracetamol is one of the most commonly used medicines in the world. Almost every household keeps it. People take it for headaches, fever, body pain, toothache, back pain, and even mild flu symptoms. Because it is easily available without a prescription, many people believe that paracetamol is completely harmless. Some even take it daily without thinking twice. But the real question is daily use of paracetamol truly safe, or can it quietly become dangerous over time? To understand this properly, we must first understand what paracetamol actually does inside the body, how it works, and how the body processes it. Paracetamol, also known as acetaminophen, is a pain reliever and fever reducer. It does not reduce inflammation like some other painkillers. Instead, it works mainly in the brain. It blocks certain chemical messengers that tell the brain that the body is in pain or has a fever. Because of this mechanism, paracetamol is often considered gentler than other painkillers and is commonly recommended for children, elderly people, and even during pregnancy under medical supervision. When you take paracetamol in the correct dose, your liver processes most of it safely. The liver breaks it down into harmless substances that are then removed from the body through urine. However, a small portion of paracetamol is converted into a toxic byproduct. Normally, the liver neutralizes this toxic substance using a natural antioxidant called glutathione. As long as the dose is within limits and the liver is healthy, this system works well. The problem begins when paracetamol is taken too often, in high doses, or for long periods without medical guidance. Many people think that if one tablet helps, taking it every day must be fine. But daily use slowly puts pressure on the liver. Each day, the liver has to neutralize that toxic byproduct again and again. Over time, glutathione levels can become depleted, especially in people who are malnourished, drink alcohol, have liver disease, or take other medications that affect the liver. When this protective system weakens, the toxic byproduct starts damaging liver cells. This damage does not always cause immediate symptoms. That is what makes it dangerous. A person may feel completely fine while silent liver injury is developing in the background. Another important point to understand is dosage. Many people unknowingly exceed the safe daily limit. Paracetamol is present not only as a single tablet but also hidden inside many cold and flu medicines. Someone may take paracetamol for headache, then take a flu syrup at night, not realizing that both contain the same drug. This accidental overdose is one of the most common reasons for paracetamol-related liver damage worldwide. When taken occasionally and at the correct dose, paracetamol is generally safe. But daily use changes the situation. Daily use means the body never gets a break. The liver is continuously under chemical stress. Over months or years, this can lead to chronic liver injury. In severe cases, it can cause acute liver failure, which is a life-threatening emergency. Paracetamol daily use can also mask underlying problems. Pain is a signal. Fever is a signal. If someone keeps suppressing these signals daily instead of finding the root cause, the real disease may progress silently. For example, frequent headaches could be due to stress, dehydration, vision problems, or sleep issues. Daily paracetamol treats the symptom but not the cause. There is also growing evidence that long-term frequent use of paracetamol may affect kidney function, especially in people who already have kidney problems or who take other painkillers regularly. While paracetamol is considered safer for kidneys than some other drugs, daily and prolonged use is still not risk-free. Another aspect people often ignore is pain tolerance and dependency. Paracetamol is not addictive in the classical sense, but the habit of taking it daily can create psychological dependence. People begin to feel they cannot function without it. This mindset prevents lifestyle changes such as improving sleep, hydration, posture, stress management, or nutrition, which are often the real solutions to chronic pain. So, is paracetamol dangerous? The honest answer is, it depends on how it is used. Occasional use for short-term pain or fever, at the correct dose, is generally safe for most people. Doctors prescribe it every day in certain medical conditions, but always with monitoring and clear limits. The danger arises when people self-medicate daily without understanding the dose, duration, and their own health condition. People who should be extra careful include those who drink alcohol regularly, people with liver disease, elderly individuals, malnourished patients, and those taking multiple medications. For them, even lower doses can be harmful if taken frequently. One of the most important things to understand is that painkillers are not lifestyle solutions. If pain or fever is happening daily, the body is asking for attention. It is asking for investigation, not suppression. Daily paracetamol use should never replace medical evaluation. Doctors often recommend using the lowest effective dose for the shortest possible time. They also advise spacing doses correctly and avoiding combining multiple paracetamol-containing products. Blood tests may be required if long-term use is necessary to monitor liver function. In the era of lifestyle diseases, many pains are linked to poor sleep, dehydration, sedentary habits, stress, poor posture, and nutritional deficiencies. Addressing these factors can reduce the need for daily painkillers. This is where lifestyle medicine and preventive care become important. In conclusion, paracetamol is neither a villain nor a miracle drug. It is a powerful medicine that deserves respect. Used correctly, it helps millions of people safely. Used casually and daily without guidance, it can quietly damage vital organs. The key message is simple: do not normalize daily painkiller use. If you find yourself taking paracetamol every day, it is time to pause and ask why. Your body may be trying to tell you something important. Medicine should support health, not replace understanding. Always choose awareness over habit, and treatment over suppression.